Ovariohysterectomy, or spaying, is a common and critical surgical procedure in veterinary medicine. It involves removing a female animal's ovaries and uterus under general anesthesia. This prevents pregnancy and manages conditions like pyometra and ovarian cysts. Veterinarians undergo extensive training to perform this routine surgery safely. Spaying improves pets' quality of life and strengthens the bond with their owners. It helps control pet overpopulation by eliminating unwanted pregnancies. Spaying also eliminates the heat cycle, reducing stress for pets and owners. This can prevent messy, noisy, and stressful heat cycles. OHE extends pets' lifespan by preventing serious health issues. Early spaying reduces the risk of mammary tumors and uterine infections. Understanding OHE surgery ensures optimal care and well-being for pets. Before surgery, careful preparation is crucial to ensure smooth operation and reduce complications. This includes gathering instruments, prepping the area, and ensuring proper anesthesia. Gather all necessary instruments to avoid delays. Tools like scalpel, scissors, and forceps must be readily available. Use a checklist to ensure nothing is forgotten. Prepare the surgical area by clipping fur and cleaning with antiseptic. Proper patient preparation is essential for success. Fast the animal before surgery to prevent vomiting during anesthesia. Administer preoperative medications for comfort and infection prevention. Anesthesia keeps the animal unconscious and pain-free. General anesthesia allows the surgical team to operate without causing distress. Monitor vital signs closely to ensure safety during surgery. With the patient properly prepared, the surgical procedure can begin. The veterinarian will make a small incision in the abdomen, typically just below the belly button. The exact location and length of the incision may vary slightly, depending on the size and breed of the animal. The veterinarian will use a scalpel to make the initial incision through the skin and subcutaneous tissue. They will then use scissors or their fingers to carefully separate the abdominal muscles, exposing the abdominal cavity. It is essential to work carefully and methodically to avoid damaging any internal organs. Once the abdominal cavity is open, the veterinarian will locate the uterus. The uterus is a Y-shaped organ located in the lower abdomen. It is connected to the ovaries, which are small oval-shaped organs located at the end of the uterine horns. Throughout the procedure, the veterinarian must handle all instruments with precision to ensure the safety and well-being of the patient. After the procedure is complete, the veterinarian will suture the incision, ensuring proper closure and minimal scarring. Post-surgery, the patient will be closely monitored to ensure a smooth recovery. After locating the uterus, the veterinarian will identify the ovaries. They will then carefully break down the suspensory ligament, a thin band of tissue that attaches the ovary to the body wall. This will allow them to exteriorize the ovary, bringing it outside the abdominal cavity for easier access. The next step is to ligate and remove the ovary. Ligation involves tying off the blood vessels that supply the ovary with a special type of suture material. This is crucial to prevent bleeding during and after the surgery. Once the blood vessels are securely ligated, the veterinarian will use scissors to remove the ovary. The veterinarian will repeat the same process on the other side to remove the second ovary and uterine horn. They will ensure that all blood vessels are properly ligated and that there is no excessive bleeding. Section 5. Closing the abdomen, securing the layers. With both ovaries and the uterus removed, the veterinarian will begin closing the abdomen. This is a critical step to ensure the animal's recovery and overall health. This is a multi-layered closure, meaning that they will suture each layer of tissue separately to ensure a secure and well-healing incision. Each layer must be meticulously closed to prevent complications. First, the veterinarian will close the abdominal muscle layer using a continuous suture pattern. This technique helps to distribute tension evenly across the incision. This will bring the edges of the muscle together and provide strength to the incision. A strong muscle closure is essential for the animal's mobility and comfort post-surgery. Next, they will close the subcutaneous tissue with another layer of sutures. This layer acts as a cushion and helps to support the skin closure. This layer helps to eliminate dead space beneath the skin and reduces the risk of seroma formation, which is a collection of fluid under the incision. Proper closure of this layer is crucial for preventing post-operative complications. Finally, the veterinarian will close the skin with either sutures or surgical staples. The choice between sutures and staples depends on the specific needs of the patient and the surgeon's preference. Skin sutures or staples are typically removed 7 to 10 days after surgery. This allows enough time for the skin to heal adequately. The veterinarian will apply a small amount of antibiotic ointment or spray to the incision to prevent infection. This final step is essential to ensure the incision remains clean and free from harmful bacteria. Section 6. Cats versus dogs. Key differences in OHE. While the basic principles of OHE surgery are similar in cats and dogs, there are some key differences in technique. In cats, the incision is typically made on the flank or side of the body rather than the abdomen. This is because the ovaries are located higher in the abdomen in cats. Another difference is that cats are often spayed using an open pyometra technique. This involves making a larger incision in the uterus to allow for the removal of any pus or fluid that may be present. This is done to reduce the risk of uterine infections after surgery. Cats also tend to recover from OHE surgery more quickly than dogs. Most cats are back to their normal selves within a few days, while dogs may take a week or more to fully recover. Section 7. Post-operative care, ensuring a smooth recovery. Post-operative care is essential for ensuring a smooth and uneventful recovery. The veterinarian will provide specific instructions on caring for the incision, managing pain, and monitoring for any complications. It is important to follow these instructions carefully to help the animal heal properly. One of the most important aspects of post-operative care is keeping the incision clean and dry. The veterinarian may recommend cleaning the incision daily with a mild antiseptic solution. It is also important to prevent the animal from licking or chewing at the incision, as this can introduce bacteria and delay healing. Pain management is another crucial aspect of post-operative care. The veterinarian will prescribe pain medication to keep the animal comfortable during the recovery period. It is essential to administer the medication as directed and to monitor the animal for any signs of pain or discomfort. Section 8. Tips for success. Best practices for OHE surgery. To ensure a successful OHE surgery, there are several best practices that veterinarians should follow. Careful patient selection and preparation. Thoroughly assess the animal's health status and ensure they are a suitable candidate for surgery. Aseptic technique. Maintain strict aseptic technique throughout the procedure to minimize the risk of infection. Gentle tissue handling. Handle tissues gently to reduce inflammation and promote healing. Secure hemostasis. Ensure all blood vessels are properly ligated to prevent bleeding. Appropriate suture selection and placement. Choose the appropriate suture material and placement techniques for each tissue layer. Adequate pain management. Provide effective pain management before, during, and after surgery. Thorough post-operative monitoring. Monitor the animal closely for any signs of complications. Section 9. Potential complications, what to watch for. While OHE is generally a safe procedure, potential complications can arise. These include hemorrhage, bleeding during or after surgery can occur. Infection at the incision site is possible. Seroma fluid accumulation under the incision can occur. Dehiscence, the incision can open up. Ovary remnant syndrome, a small piece of ovarian tissue may be left behind, leading to continued heat cycles. Ligation of the ureter, accidental tying off of the ureter, which carries urine from the kidney to the bladder, can occur. By following proper surgical techniques and providing appropriate post-operative care, veterinarians can minimize the risk of these complications. However, it is essential to be aware of these potential problems and to monitor patients closely for any signs of trouble.